started a journey with my thyroid in early 2020 when I was putting on my makeup and just doing my normal skincare routine, and I noticed a small bump on my thyroid. Unfortunately, at the time, I was a little lazy about the care that I should have pursued right away, and I did not go and get it checked out. But by mid-2020, I could see a visible change. And so I realized that it was time to speak to my healthcare provider about it. I went to my primary care physician, and she, of course, referred me to an in-network endocrinologist. And we started the process of trying to diagnose what was going on. So I had a series of ultrasounds, which led to some biopsies and things, and just the diagnosis of a thankfully benign thyroid nodule. However, it was growing really quickly. So we began a period of sort of watchful, just observing and continuous monitoring to see what was going to be needed, and the growth continued. So the nodule began to become quite large, and I began to experience some obstruction issues, just kind of random choking, mostly, just embarrassing things, nothing serious. But it began to be pretty regularly a part of my day. And then I began to experience some hoarseness with my voice, which I was kind of acutely aware of because at the time I was doing quite a bit of singing. So I started noticing those kinds of things. My provider at the time recommended that I have my thyroid removed because there was not, in his estimation, there was not really a treatment for the nodule. I was just going to have my thyroid removed. And that solution really was very unappealing to me. I have family members and very close friends who have either gone through a removal of their thyroid or who have dealt with things like Hashimoto's. And I have seen, very closely what the process looks like to try to balance all of the hormones and the medications, and how delicate that balance can really be, how difficult it is to maintain. So I was really disappointed by the idea of having to make that a part of my future. So I started doing some research, and in the course of my research, I found out about radiofrequency ablation for thyroid nodules. So then, of course, I started looking for whether there was someone here in the North Texas area that I could go and see if I would qualify for that, or if that was an option for me. And thankfully, I was able to find Dr. VanDyke, and amazingly, she was just a few moments from my own home. So it just really felt like it was going to be a blessing in my life to come under her care. So I was able to set myself up and get an appointment to see her. And I instantly was impressed by just the overall practice, how comfortable it is to be under her care, how transparent she is with information, with pricing. I just really appreciated her whole approach. So thankfully, after some additional testing, we were able to determine that RFA was going to be a viable option for treatment for me. So I got to come in to a familiar facility. I didn't have to go to a hospital. I didn't have to go to a surgical center. I was just able to come to a place that I had already been. I got to see the faces that I already knew, and I was able to have the RFA procedure done. And then I was able to just immediately return home. After the RFA procedure has been done, I've had all of my follow-up appointments, and it has been amazing to see that this nodule has gone down. I think at my last appointment, she said that I have about a 79% reduction in the size of my nodule, which means I'm no longer experiencing any choking incidences. I do not have the hoarseness in my voice any longer. All of those symptoms have gone away, and I don't have to worry about them now going forward. So for the actual day of the procedure, everything was really, really simple. I got to come here. I'll start over. Sorry about that, a little froggy. So for the procedure itself, it was very, very simple day. It was actually a little relaxing. I got to come to the office. There was no need to go anywhere else. I didn't have to make any real special preparations or anything. It was very comfortable. It was literally just a matter of essentially lying back, and then there was a mild sense of pressure during the procedure itself. I've had worse experiences as far as pain or discomfort is concerned at the dentist, or having something as simple as a strep test, not a stress test, a strep test at the doctor. The discomfort was absolutely so much less than I would have expected. And then the beautiful thing about it was, after a wonderful nap that afternoon, I woke up and I really had no residual pain afterwards. There was some very minor bruising. I think it was maybe the size of a nickel. And it was very easy to conceal with either clothing, or I guess I could have used a Band-Aid. But there were no complications. There was nothing difficult to manage afterwards. And then just the reduction in size was quite noticeable very soon afterwards. So what would I say to someone hesitant about seeking treatment for similar issues? Stop waiting. Engage in a pursuit of your health, and just talk to Dr. VanDyke. There's nothing wrong with doing some investigating to find out whether or not this is going to be a viable treatment option for you. And if it is, go for it. It was such a wonderful change to my quality of life to no longer have to worry about whether or not I was going to be choking when I took my daily medications or my daily pills. That was such a relief. So go ahead and just ask questions. Come and talk to someone who is interested in your well-being, because this might be a fabulous opportunity for you.